Marco, my pleasure to meet you. Can you tell us something about Canbiola?
Pleasure to meet you as well. Canbiola is a publicly traded company.
Wait. You gotta
We'll edit.
Well, you gotta face Canbiola. You're facing their thing.
All right, yeah, come back here.
He's got their name.
All right, so we're going to edit this. Investor relations person, email, how you got into the business, why Canbiola is going to be a big winner, the company, the great men that you have working with you, style of hiring, all those things. But short and sweet.
I'm going to try.
Okay. 1, 2, 3. I'm here with Marco from Canbiola, publicly traded company, CANB.
Good morning, Mark. Pleasure to have you at our booth. We're at the Javits Center today, and I'm going to introduce our company to you. We make a full line of tinctures from 250 milligrams to 5,000 milligrams. We're currently in approximately 380 physician offices throughout the United States. One of our bigger clients is Northwell Health that we picked up about a week and a half ago. We're in their pharmacies, Viva pharmacies. More importantly, the difference between myself and the other companies is how we process our material. We use shy farms to grow our biomass, and we use Mile High to do the extraction. We use ethanol extraction with medicinal grade alcohol. One of the 2 requirements we have is that they strip out 100% of the THC and they strip out all the terpenes. I'll tell you why in a second. At that point there, it has to test out at 99.9% pure for us to bring it in-house in Seattle, Washington, where we manufacture all our own products. We have one more proprietary technology. If you were to break up a kidney stone in a patient, we agitate it. More importantly, we bring our molecules down to 30 to 40 nanometers. The reason we do that is because the bioavailability of our product compared to others is 8 to 10 times greater sublingually. At that point there, we buy our terpenes separately and we reconstitute them back into the mix on a measured basis. That's why our products always test out identical across the board. A big competitive difference than anyone else. We also do carry a full spec item. One of our divisions is called Canbiola. Those are clinical only and for pharmaceutical. Then we have Pure Leaf Oil, which is our label for the bodegas and C-stores. And we just picked up 7 Chakras, is where we have all the tchotchke stuff. So we make bath bombs, bath salts, we make a full spec item, we make capsules, dissolvable tablets as well. Then we have our Duramed division, which we were able to acquire the technology from Huda Labs. Huda Labs, these are the TENS units that we impregnate with CBD. We have them up to 850 milligrams per tablet. Then we got into the SAMS unit. It's sound stimulation. And these patches, now we're creating, instead of ultrasound gel, we're adding CBD to the ultrasound gel. We're able to penetrate approximately 2 inches into the body. The unit is FDA approved. And that's been going well. Corporately, we've been growing year after year. Our numbers came out in 2018. We did approximately $668,000. Q1, we already have $517,000. It's out on the wire. We anticipate the growth model continuing into 19, and we're going to be vertically integrated at the end of the day.
Awesome. So my question is, on your initial offering, how much capital did you raise?
We did it. We did an S1 filing, and we put our company into the S1 filing. Okay. We have recently raised an additional $2 million at 0.029 cents. The Reg Ds are filed with these, SEC.
Right. When you go to hire people, what type of people are you looking for?
So the kind of people we have on our management team are medical physicians. We have 8 medical physicians. We have Dr. Weisberg, Dr. Fratelloni, Dr. Salerno, and we have 5 others. On our corporate advisory board, it's kind of unique and different. We have a gentleman called Johnny Mack, who is the trustee for the Gandhi Foundation, as well as the Martin Luther King Foundation. We have former Senator Ron Silver, 14-year senator for Florida, is now writing the marijuana laws for the state of Florida, helping them with the marijuana laws. So we try to bring in the highest level of competency to our team.
What's the risk in the industry from your perspective?
The risk in the industry from our perspective right now is the educational part. You need to have these people educated, and there's a lot of other companies that don't have lab results. All our products come with lab results and lab reports, and those guys are going to end up being weeded out.
As a CEO, what are your plans of reaching out into the minority communities to help them
Bring in some products.
bring in some products to help them stay on their feet in terms of distribution of an industry that they grew? What is your plan as a CEO to do the right thing for the minority communities?
That's a good question. Not only minority people, but the vets.
Right.
We're part of the DOD right now. We're going to have a symposium down in September for the wounded warriors. We're trying to give back as well. Our new deal that we have with a number 2 distributor is that we give 5% of every sale to the vets. So we're trying to give back to the vets.
Are you willing to set up a startup business incubator to help people along, vets in particular, that's close to your heart, or minorities?
Absolutely. We have a couple of guys now from Utah that are vets that have come into the company, and we're trying to get them going. We help them with the labeling. We picked up the cost on the labeling. So anything we could do for a vet, because they surely deserve it.
I'm sure there's a lot of great vets that want to hear that. Thank you very much, sir, for your time.
Pleasure is mine.